Well, I would like to ask for your permission to use this video for educational purpose and on internet publishing.
Yes, sir.
Thank you. Now tell me, you told me about your pain before the surgery as well as your posture, and tell me a little about what were your symptoms, how were you before the surgery?
Before the surgery, I couldn't sit very long, couldn't stand very long, sharp pain down my leg, numbness a lot of times. If it would go too numb, my leg would give out.
How bad was the pain?
Some days, good 9.
Okay. How many years?
Tears. I'm dealing with this for the major pain for about 5 years, and
5 years.
before that it just slowly progressed. But
Okay.
I was a gymnast for 20 years and major arched back.
So you
After the surgery, my back isn't as arched; it's straighter.
Yeah, so
not having that pinching pain
yeah,
anymore.
but so you couldn't stand straight before the surgery for many
Nope.
years.
I was more of a, either I was really arched back or I was leaning forward because I couldn't do the position, proper positioning.
And you told me right after the surgery, or pretty soon after, you could stand straight again.
Yep.
That is special for you.
And it was different. It was definitely something new.
Okay. No, but you know, so how bad is the pain right now?
Probably only at a 5, and I'm only 1 month out, so that's pretty darn good.
Okay, but you know, actually.
But there's no more nerve pain. That nerve pain I had before surgery is gone.
In the leg. Okay.
It is gone.
But I remember.
So it's just healing pain that I'm really dealing with. So
excellent. But actually, we talked as well about that you are not one of my best results because you are within that 15% that we talked about before the surgery.
Yeah, we didn't know how much relief I would even have. We thought we'll have some, but we can't guarantee that it's going to be completely better. And I'm shocked that it's better than it was before.
But
already.
You after the surgery, you got this on the left side. You got that nerve irritation, correct?
Correct.
Okay, we talked about it before the surgery. What do you remember? What I did tell you before the surgery about that nerve irritation?
I don't remember the percentage, but I do remember us talking about it and saying that a lot of people would get numbness, tingling, or weird feelings on your foot, possibly up to your leg, depending on what nerves were irritated from pulling them apart from going in because of the tiny spaces. And
you're describing it pretty well.
I paid attention.
So we talked about that multiple times before the surgery, and one more time right in the morning of the surgery. We talked about that, and that risk is generally we consider it up to 15%, but in realistically, you know, after surgeons are more familiar with that, it's actually lower, but we don't really know how much lower, but for all practical purpose, we tell the patient about 15%. And you know, and you had it. Can you describe it how it was and how you are now with that nerve irritation?
Post-surgical, you mean?
Yeah.
The day after surgery, well, even the day of surgery, but the day after surgery, that nerve pain was a definite 8 or 9. It was bad, and I was honest to God. Like, oh my God, is this pain ever going to go away? This is worse than what I had before surgery. And it did make me nervous. And slowly it's been getting better, and now I don't have it
and
at
you're just
all.
4 weeks after the surgery.
And now it's just a little bit of tingling in my foot, so it's gone down. So, yeah.
The prognosis of that nerve root irritation is fantastic, and we compared it as well to open surgery. Actually, open surgery is much riskier in all literature, much riskier than the data we got, but you knew about the risk of that and you still decided you want to go through the surgery. Why? Why did you take that risk?
Because I felt that the percentage of me being better than what I was worth it.
Yeah, so it was worse for you because you told me I think you just couldn't live with that pain anymore.
No, I just didn't want to be that person that couldn't be with their family and just sit in the chair anymore.
Okay, well, thank you so much for the interview.